Hello my people, you're welcome back to my YouTube channel. In today's video, we'll be discussing on sickle cell anemia, its cause, complications, and its prevention. So please do not forget to subscribe to my YouTube channel and give me a thumbs up. Love you all. So let's get started. Sickle cell anemia is an inherited disorder known as sickle cell disease, and it affects the shape of the red blood cells, which carries oxygen to all parts of the body. Red blood cells usually they are round in shape and flexible so that blood can move easily throughout the body, throughout the blood vessels. They are round and they are flexible so that blood moves easily through the blood vessel. But in sickle cell anemia, the red blood cells are shaped crescent moon. Their shape is like that crescent moon, it's like a C, a curved shape. And this shape makes it rigid and is sticky, and it causes slow movement of blood flow to the body systems. You get. So now, what are the symptoms? So let's get into the signs and symptoms. One of the signs and symptoms is anemia. Normally, red blood cells live for 120 days before it's being replenished. But in a case of sickle cell disease, their red blood cells live for 10 to 20 days, then it's dead, thereby leaving the body in a shortage of red blood cells. And this is what causes the anemia. And as a result of this shortage of red blood cells, it also leads to low oxygen circulations to the body, which also makes the individual to be fatigued. Okay. So the second symptoms is episode of pain. They usually have periodic episodes of pain called pain crisis. And this usually occurs when sickle shaped red blood cells are being blocked. When the flow of the blood vessels is being blocked because their blood vessels is usually tiny. Remember, it's a crescent moon shape. So when the red blood cell is blocked, there's not enough blood flowing to the heart, to the joints. This causes a serious pain, which may last for a few hours or few days. But in a, in a serious situation or in a severe pain, hospitalization is required or advised. So the next symptom is swelling of hands and feet, and this is as a result of a blockage in the flow of blood to the hands and to the feet. It will now cause a swelling on those joints. You see their hands to be swollen. So it's as a result of this shortage of blood flow to that area because of blockage on the vessels. So the next sign and symptom is frequent infection. Sickle cell can damage the spleen, thereby increasing vulnerability to infection. And that is why newborn babies or infants with sickle cell anemia usually receive vaccinations and antibiotics to prevent life-threatening infections such as pneumonia, because sickle cell they are always prone to infection. You have delayed growth and puberty. The blood that provides red blood cells is what provides oxygen and nutrients to the body. So due to shortage in red blood cells, this will also lead to stunted growth because they are not getting enough oxygen, neither are they getting enough red blood cells. Neither are they getting enough nutrients that will help in growth and development. You have vision problem. The blood vessels that supplies the retina is the part that is responsible for vision. When those blood vessels are being blocked, it will lead to blood, it will lead to vision problem. So now let's get into the causes. Sickle cell is caused by a change in the gene. It's a change in the gene called hemoglobin. And this hemoglobin is what carries oxygen from the lungs throughout the body. That is the work of the hemoglobin. It enables the red blood cells to carry oxygen from the lungs throughout the body. And for a child to be affected, to have this sickle cell gene, it must carry this gene from both the mother and the father. But when the child carries only one of the gene, maybe from the mother or the father, it is called sickle cell trait. But for it to have this sickle cell gene, it must carry the sickle cell gene from the mother and the father. That is the SS gene. Then the complications now. So let's get into the complications. Complication is a life-threatening situation that needs urgent hospitalization or attention. So one of the complications is stroke. And this stroke comes to play when the blood vessels that supplies to the brain is being blocked. Then signs of stroke will appear such as numbness of the legs and arms, seizure, sudden speech difficulties, and unconsciousness. So when all these things appear, of course, hospitalization is required immediately. Then the next signs and symptoms is acute chest. The next complication is acute chest syndrome. And this acute chest syndrome is when the vessels that supplies the lungs are being blocked by the sickle cell. It causes a life-threatening complications resulting to chest pain, fever, difficulty in breathing, and even may require urgent medical treatment. Of course, complication is something that requires urgent medical treatment, and it doesn't need to be played with at all. Then we have pulmonary hypertension. People with sickle cell diseases, anemia, they are prone to development of high blood pressure in their lungs, and this leads to shortage of breath and fatigue, and this complication can be fatal. It can be fatal. Then you have organ damage. When vessels that transport blood and oxygen to the organs are being blocked by sickle cell, this leads to damage of nerves and organs such as the kidney, the liver, and the spleen. And it is also fatal, of course. It's very, very fatal. You know why I always say blockage of blood vessels is because of the shape of their red blood cell. It's a crescent, it's just like a C shape. Instead of it to be like normal shape that is round and flexible, allowing blood to move freely. But their own is very tiny. So any small thing can block the vessel. And once it is being blocked, there are lots and lots of problems that will come up. So you have splenic sequestration. A large number of sickle cells that get trapped in the spleen causes this spleen to enlarge, thereby leading to splenic sequestration. We have blindness. Just as I said before, in the symptoms, visual impairment. You get, so complication is now blindness. When there is a blockage in the blood vessels that supplies the retina, if it is not being rectified on time, it leads to blindness. That is why it's always needed to treat. The sickle cell patients needs to pay more attention on. You get, so have gallstone. The breakdown of red blood cells produces a substance called bilirubin. And this bilirubin, when it is high in the body, it leads to gallstone. We have leg ulcer. Sickle cell patients always have a very painful pain on their leg when they get injury. You get, thereby leading to this leg ulcer. Please, if you have a sickler in your home, always try as much as possible to pay attention to them. So now there are preventions. How can you prevent this from occurring? How can a mother prevent this from having sickle cell child? Of course, the both partners need to meet with their genetic counselor before trying to conceive. If you've already married, before noting that you are AS, both of you are AS, because it's only AS can give birth to sickle cell. Then AS and SS can also give birth to sickle cell. But if you are AS and you married AA, you can only give birth to a sickle cell trait. It can have that sickle cell gene, but will not carry all these signs and symptoms. So that is why it's always advisable for you to do a blood group before you and your partner, before getting into marriage. If you find out that you both are AS, please, no matter the love, just quit the marriage to save the future children. But if you must marry, then before start giving birth, meet a genetic counselor before trying to conceive, so that he will help you to understand your risk of having a child with sickle cell, you get, and also explain the possible both the possible treatment and preventive measures that you will take. So that is the only prevention. Then the treatment of a sickle cell patient is bone marrow transplant. Of course, you've seen when you finally get married and you now have a child with sickle cell disease, this bone marrow transplant is quite high for you to do. The money is quite high. But if you can, why not? You can continue. Then what are the lifestyle behaviors a sickle cell patient should adopt to help prevent them from all these infections and from getting sickness, from being sick or that? Just try to drink enough water. Drink plenty of water. Plenty of water actually help a lot. Try not to get too hot or too cold to avoid blockage of those vessels where the blood flows, because they don't have enough space. The blood vessels does not have enough space for blood to flow easily. So getting too cold can actually block the blood vessels, in which blood supplies to some areas like the joint may be limited, and you see the individual having joint pain, arm swollen and all that. Then try to avoid places or situations that causes exposure to high altitude, like flying. You will get, it can, or climbing mountain. It can bring up some symptoms that you may not really like. Then steps to prevent harmful infections. One of the steps is wash your hands frequently. Wash hand before eating, wash hand after eating, wash hand before using the toilet, wash hand after using the toilet. Just try to maintain as possible as personal and environmental hygiene as possible as you can. Prepare your food safely. Use your hand to prepare your food so that you can wash both the fruits and the veggies very well to avoid infections. Please just try as much as possible to do all those things, and you see yourself living just like a normal human being. I have one of my friend, if you see her, you hardly believe that she's a secular. Yes, she's well treated, and she observes this personal and environmental hygiene very well. She takes her nutri, her multivitamins, takes enough fruits and veggies. She hardly falls sick. She's married with a kid. you see. So just try as much as possible. And she married to a man with that is AA. So she cannot even give birth to a sickler. You get, she can only give birth to threats. You get, to a carriers, that is sickle cell carrier. So please just try as much as possible to maintain, and also advise those that you know that wants to enter into relationship that may lead to sickle cell. Just can still help them, can still download this video, share it to those you know that it will be helpful to. Please do not forget to subscribe to my YouTube channel. Also give me a thumbs up. See you next time when I upload a new video. Thank you very much, and I love you all. Remember to love one another. Thank you. Have a nice day. Bye.